This past 2 weeks, we released some videos just about basic concepts in terms of refractive errors. What's myopia, hyperopia? What does it mean to be nearsighted? What does it mean to be farsighted? What does it mean to be presbyopic? Next week, we're going to be talking about glaucoma and recovery from glaucoma surgery, specifically glaucoma tube surgery. But I did want to give share a few patient stories from this week. I've been doing this a long time, and this week I heard, I had two patient experiences that stick out that I remember. So one patient is a 74-year-old gentleman who we did cataract surgery in both eyes just in the last month. And I saw him today. I think it was his 3 or 4 week follow-up. Now, his prescription before surgery was about a -12 or so. And when I asked him today how things were going, he was, he was happy, of course, but he said something. He said, I have a new life. And that was, really like, yes, he could see better, but to hear him say, I have a new life, he said, I've been wearing glasses for the last 70 years since I was 4 years old. Now, someone who's that myopic, that nearsighted, he did have cataracts, and his vision before surgery was probably in the 20/70, 20/60 range. So he had significant cataracts, but he was also amblyopic in both eyes. So he did have an improvement in vision, but it wasn't, his vision didn't get all the way to 20/20. But for him, he could see distance without having to wear glasses anymore, and that was a profound change for him. So that was pretty cool. But the one patient where I did hear something that I'd never really heard before from a patient was this woman who was probably in her 60s, and she'd had bad diabetic retinopathy, and unfortunately had lost vision in one eye. Very dense cataract in the eye that she'd lost vision with, very dense cataract in both eyes, actually. But for whatever reason, she had not had cataract surgery yet, despite having really quite poor vision. I think other ophthalmologists who had seen her in the past perhaps were worried about her diabetic retinopathy. Perhaps her diabetes wasn't controlled, and a lot of focus was on her eye that had the more advanced cataract, where her vision was really just light perception. And at that point in time, people had been looking at the eye and then hesitating on doing surgery in that eye. When I saw her, her vision in her poorer seeing eye was light perception, and in her good eye, quote unquote good eye, her vision was 20/400. This poor lady had been walking around she was legally blind really for several years. And I agreed to do her cataract surgery, but I told her we're going to do surgery in your better seeing eye, because I didn't think really she would have much improvement in the other eye. So we did surgery on her better seeing eye, the eye that was 2400, and it was a bear of a case. I mean, I've done a lot of cataract surgery. It was probably one of my most difficult surgeries that was uncomplicated. So there was no complication in the surgery. We got through it. She was awake during the entire thing and was talking to me, and she was a trooper. And she was really apologizing to me about how bad her cataract was. And she was really just a superstar. And so obviously with a cataract that dense, she had a lot of corneal edema, but right away from the beginning, she could tell her vision was better. And I saw her 2 days ago, yesterday actually. I saw her yesterday. And she was 20/50 in that eye, her better seeing eye, and with glasses she got to 20/40. And this woman, what she said to me, I asked her, how things were, and she was of course very happy she could see again. She had been legally blind. But what she said to me, which really, I don't think I've really heard before. She said, I've met all these people in the last few years, and I never knew what they looked like. So I would see them, and I would not recognize them, and I would think they were strangers. But as soon as they started talking, I realized that it was somebody that I knew really well. And she had known people and gotten to know people over the last several years and only knew them by their voice. And now that she would see them, they were strangers to her. She'd never really seen what they looked like before. And so she would treat them as strangers. And then as soon as they started talking, she would realize it was someone that she knew well. That was really but just the blessing of being able to see. You don't realize what someone who's lost their vision, what they go through. And the other thing that she had said, I asked her, well, I'm sure it's a big change for you, and I'm sure that, you've been really dependent on other people before. And she said, yes, even now, like when I get up to go to the bathroom, my husband will get up right away too, because he'd always had to lead me everywhere in the house. And I say, no, I got it. I can, find my way now. And he'd always be like, are you okay? But she said, even now, 2 months after surgery, every time I get up, my husband wants to get up because he's just so used to like leading me around everywhere. But that was really cool. I mean, that was, obviously, a really emotional story. And it was just such a privilege to, witness that in someone's life. And yeah, it was really cool. I mean, I think when you're seeing patients and you're busy and, you're just trying to make it through clinic, it's just nice to be able to take a minute and just hear those stories and realize, the impact, of what we do as ophthalmologists, of what we do as eye surgeons. And really, it was really cool. So anyways, those were 2 patient stories that stuck with me this week. Next week, I'll be releasing on Monday a video about glaucoma and how to, what to expect when someone's, recovering from a glaucoma surgery. Check it out then. I appreciate your support. Please, comment and let me know what else you guys want to hear about or what other eye topics you want to hear about. All right. Have a good evening.